Lansoprazole, also known as acid reducer, is a medication used to treat stomach and esophagus problems such as acid reflux and ulcers. It works by reducing the amount of acid produced in the stomach, relieving symptoms like heartburn, difficulty swallowing, and cough. This medication also helps to heal acid damage to the stomach and esophagus, prevent ulcers, and may even help prevent cancer of the esophagus. If you're using over-the-counter Lansoprazole products to treat frequent heartburn, it's important to note that it may take 1 to 4 days to have a full effect, so it doesn't provide immediate relief. Make sure to carefully read the package instructions and check the ingredients on the label, as different products with similar brand names may contain different ingredients meant for different purposes. It's important to take the right product to avoid any harm. Lansoprazole is not recommended for use in children younger than 1 year due to an increased risk of serious side effects. If you have any concerns about using this medication, it's best to consult with a doctor or pharmacist for more details. Before taking Lansoprazole, make sure to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth before a meal as directed by your doctor, usually once daily. If you are self-treating, follow all directions on the product package. The dosage and length of treatment are based on your medical condition and response to treatment. Children's dosage is also based on age and weight. Do not increase your dose or take this drug more often than directed. If you have any questions, ask your doctor or pharmacist. Do not crush or chew the capsules. Swallow the medication whole. If you have trouble swallowing the capsule, you may open the capsule and sprinkle its contents on a spoonful of soft food, such as applesauce, cottage cheese, yogurt, and swallow the mixture right away without chewing it. Or you may empty the capsule's contents into a small amount, 2 ounces or 60 milliliters, of juice, stir, and drink the mixture right away without chewing it. Then rinse the glass with more juice and drink to make sure you have taken the entire dose. Do not prepare the mixture ahead of time for later use. Doing so may destroy the drug. If you are giving this medication through a tube into the stomach, nasogastric tube, ask your healthcare professional for detailed instructions on how to properly mix and give it. If needed, antacids may be taken along with this medication. If you are also taking sucralfate, take Lansoprazole at least 30 minutes before sucralfate. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Continue to take this medication for the prescribed length of treatment even if you are feeling better. If you are self-treating with the over-the-counter product, do not take it for more than 14 days unless directed by your doctor. Tell your doctor if your condition lasts or gets worse. If you are self-treating, tell your doctor if your heartburn lasts after 14 days or if you need to use this medication more than once every 4 months. The risk of side effects goes up over time. Ask your doctor how long you should take this medication. If you think you may have a serious medical problem, get medical help right away. It's important to be aware of the potential side effects of using acid reducer, Lansoprazole, 15 mg capsule. Some common side effects include diarrhea, abdominal pain, or headache. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. However, many people using this medication do not experience serious side effects. It's important to remember that your doctor has determined that the benefits of using this product outweigh the potential risks of side effects. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you experience persistent diarrhea, abdominal pain, or blood/mucus in your stool, it's important to seek medical attention right away. Additionally, long-term use of this medication may rarely cause a vitamin B12 deficiency. If you experience symptoms such as weakness, sore tongue, or numbness/tingling of the hands/feet, it's important to notify your doctor. It's also important to be aware of the potential for a serious allergic reaction to this drug. If you experience symptoms such as fever, rash, swelling, severe dizziness, or difficulty breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you have any concerns about the side effects of this medication, don't hesitate to discuss them with your healthcare provider. Before taking Lansoprazole, it's important to talk to your doctor or pharmacist about any allergies you may have to similar drugs. Also, be sure to discuss your medical history, especially if you have liver disease or lupus. If you experience symptoms like heartburn with lightheadedness, sweating, or dizziness, chest or jaw pain, unexplained weight loss, trouble swallowing food, bloody vomit or stools, or frequent chest pain, it's important to seek medical help right away. Before having surgery, make sure to inform your doctor or dentist about all the medications you are taking, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult, it's important to be aware of the potential side effects of this medication, such as bone loss and fractures, and C. difficile infection. Talk to your doctor about ways to prevent these side effects, such as taking calcium and vitamin D supplements. If you are pregnant, discuss the risks and benefits of taking this medication with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if the medication passes into breast milk. When taking acid reducer, Lansoprazole, 15 mg capsule, it's important to be aware of potential drug interactions. This medication can affect how other medications work, so it's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One specific product that may interact with Lansoprazole is methotrexate, especially when used in high-dose treatment. Additionally, some products require stomach acid for proper absorption, and since Lansoprazole decreases stomach acid, it may affect how well these products work. It's important to be cautious when taking Lansoprazole alongside medications like ampicillin, atazanavir, erlotinib, and others. It's also crucial to note that Lansoprazole is very similar to dexlansoprazole, so it's important not to use medications containing dexlansoprazole while using Lansoprazole. Finally, this medication may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. If your doctor has prescribed this medication for you, it's important not to share it with others. If your doctor instructs you to use this medication regularly for a long time, you may need to have some lab and/or medical tests done, such as a magnesium blood test and checking your vitamin B12 levels. It's important to keep all your medical and lab appointments, so make sure to consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When storing Lansoprazole 15 mg capsules, make sure to keep them at room temperature in a dry, dark area. It's important to keep this medication out of the reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it down the drain unless specifically told to do so. Instead, discard the product properly when it's expired or no longer needed. If you're unsure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.